record on this computer. Okay, so welcome everyone to this webinar tonight, and thank you so much to our guests at Downballot Progress for doing this event with us. We're really excited to meet them, and we think that the future of both of these organizations is just super exciting. Both of these organizations, I think, have their eyes correctly set on the states and recognize the incredible power of the states. And so that's why our icebreaker tonight is one fun fact about your state. And part of the reason we want to do that is just so we can see the incredible breadth of people who have joined us from a bunch of different states. So you can drop that in the chat. You can add your state to your name on Zoom so we can see that. And I hope we all, just get to know each other a little bit and maybe even follow up after this. And the more connections there are between more and more people across the state, across the states, I think the better we're going to do. And so we actually have this link here in the agenda, which if you need it to be relinked to it, the agenda has a link to our Slack. And really what this is going to do is it's going to kick you into our code of conduct, because to participate in any of our events, including tonight, including in our Slack, you do have to follow by our code of conduct. But once you fill this out, it'll send you a link to our Slack, and you can get right in there and start organizing with us. So we have a completely doors open policy with Medicare for all everywhere. But I'd love to just hand the mic to Downballot Progress in a second. I just wanted to do a brief introduction for them, although I'm sure they're quite capable of introducing themselves. But I happened on Downballot Progress and, spent a little bit of time on their website and knew right away that this was the kind of group that I was interested in working with. And if you pop over to their About page, they have a section on healthcare. That's my issue. It's what I'm most interested in. And they said, we need Medicare for all from our federal government, but states can do so much to advocate for it along the way, from creating single-payer systems in individual states to enacting legislation that eliminates incentives for healthcare companies to profit off our well-being. There is so much legislators can do in the end. Over 40% of Americans are one $400 medical bill from going into debt, and no one should be scared to go to the doctor because of costs. We need to make sure everyone in the U.S. has healthcare, no matter whether it is mental, physical, or reproductive care, in a physically accessible and reliable manner. So we love that because it has that entire view down from the change that can happen at state level up to federal policy, which is what we ultimately really need when it comes to healthcare. So this is an exciting group for us to meet and to hopefully work with, not just tonight, but in the future. And I just want to encourage you all, you can go to their website. They've got a donate link just up here at the top. Looks like it's using ActBlue. But if you like what you hear tonight, if you are excited about Downballot Progress as we are, please consider sending them a donation. It helps build these sorts of movements. And we just are so pleased that they have chosen to do this event with us tonight. So with that, I'd love to hand the mic to Amory or any of the other folks who are presenting with Downballot Progress tonight, who will tell us a little bit more about their work and their organization.
Hey, yeah, of course. Thank you. Just want to make sure I have everything here. Would love just to start with that video that you had up. I can grab it too. But just give me 1 second here. And if you don't mind, I will go ahead and share my screen and play it.
You probably need permission for that. So I'm quickly, here we go. Oh, maybe you're fine.
Yeah, hold on 2 seconds, sorry. No, I am not okay with that.
Oh, here, let me do it. I don't know why it's
okay.
just gonna So this video is also linked in the agenda, everyone, and I'm sure Betty can drop a link. But yeah, this video I think should give you a great rundown of what they're
Women
about.
got the right to vote one state at a time. First, the Wyoming Territory in 1869 passed women's suffrage. Then the Utah Territory, then the Washington Territory. Before the US adopted women's suffrage in 1920, activists were lobbying state by state. Women in California won the right to vote a decade earlier in 1910 because a progressive legislature made it a ballot measure. Every success snowballed and energized more organizers. Kansas in 1912, Nevada in 1914. If state-level activists weren't working as hard as they were, who knows when women's suffrage might have passed? We at Downballot Progress understand this, which is why we're devoting all of our energy to building progressive state legislatures. Because if blue states are going to become leaders again and truly beat the GOP machine, we don't just need more Democrats. We need more progressives. Democrats without corporate ties or money from developers. The status quo isn't good enough. We need progressives passing laws and creating pressure from the state level on the federal government to codify our rights so that our freedoms aren't under constant threat by conservative legislators and courts. When it comes to climate action, to a livable minimum wage, to police reform, every state matters. Our project is fostering strong progressive movements at the state level that are going to fight. To fight for the things we want, to fight for the things we're always in danger of losing, and to show up for those fights ahead of the crowd. All the freedoms many of us take for granted, there was a point at which those freedoms simply didn't extend to everybody. Everything from marriage equality to child labor laws to voting, before those things were laws of the land, there were state legislators writing laws, amassing popular support, and building pressure. People who were there for the cause because it was right, and because they knew if they could get it passed in their state, it was only a matter of time before the next state, and the next, and eventually, the whole country. Join us at Downballot Progress to support our project and build the future.
All right, thanks, Andre. I really appreciate that. So as that video just mentioned, we're a 501c4 nonprofit organization aimed at building a volunteer and staffing infrastructure for progressive candidates and lobbying elected officials within state legislatures. We don't believe that our path to a healthy country just runs through solely purple states. We believe that they run through blue states as well. So you guys know a little bit more about me before I jump into why specifically we need to organize more in blue states, which I don't think I'm going to really run into any opposition here in this group. But it's where I got my organizing started. I would work hard to elect state representatives and senators in blue states, especially Massachusetts, where I initially lived after college. And then stare at the results and ask how, did this mainly affect the state legislature? And, not to disparage the work that I did, but the short answer was that it wouldn't. And that's because there are already those in power protecting the status quo who are in office only to serve themselves. And just because they were Democrats or quote unquote Democrats, they were not being challenged in safe blue states. There are tons of quote unquote Democrats who would be Republicans in any other state if they lived in a purple or red state. And when I moved to New York, it was clear that it was the same everywhere. So why did we start down ballot? We started down ballot because California can't pass a bill to ban corporations from donating to politicians. New York hasn't passed climate legislation for 4 years. Rhode Island had 20, or still has 20 plus sitting state representatives and senators who voted against codifying Roe v. Wade. These aren't, yes, we are pushing forward progressive candidates, absolutely, but there is a lot of work to be done in addressing the people who are not even in line with even the Democratic National Party's platform. These aren't normal people that we're aiming to push out. These are people who go against those basic principles. Because if they aren't leading the way, then there's nothing for Democrats in purple and red states to point to as an example of what's possible. And it leaves Democrats vulnerable to avoidable mistakes like we did this year. So this past cycle, what did we aim to do to accomplish that? We wanted to become a resource for the progressive movement on state legislatures. We wanted to create a volunteer base for promoting legislation and elevating candidates for state legislative office. We wanted to promote existing amendments that were out there that would strengthen our democracy, that promotes solutions like canceling the Electoral College, adding a voting rights amendment to the Constitution, something that surprisingly does not exist, and getting rid of corporate money in politics. We ended up researching over 2,000 state legislators' records on issues. We named roughly 150 state legislative allies that promoted campaign finance reform. We engaged voters in over 10,000, I'm sorry, we engaged over 10,000 voters in key states promoting get out the vote efforts. And we grew to a team of 4 individuals and 3 advisory board members. Most importantly, we're creating an organization by people. We have a donor base of over 1,000 individuals, and creating an organization from scratch isn't easy, as you all know, but we were able to do it. And so we're pretty proud of that. There are a lot of things left that we need to do and improve upon. For example, we need to be better about organizing volunteer shifts en masse, because that's what we came here to do. But we're confident that with this donor base and attaining our goals, that we're here to stay for at least this next cycle. You know, before I turn it back over, I did kind of want to just go over, you know, this past election cycle. Not that we all need to rehash it out, but what I did want to mention is, you know, while Democrats did fairly well relative to past results, and, you know, we gained trifectas in Michigan, Minnesota, and Maine. Did we get one in Maine? I know someone from here is in Maine, but I'm not entirely sure about that. You know, the Democrats lost the United States House of Representatives because of a situation in New York. During redistricting, New York's maps were initially struck down by a conservative judge who was appointed by former Governor Andrew Cuomo, and then subsequently approved by the New York State Senate. If the New York State Senate did not approve and just rubber stamp another Cuomo appointee, then Democrats would have had a more favorable judge looking at the maps, which would mean that you were looking at a 6-seat swing from this past November's results back towards Democrats, potentially giving Democrats the majority. And it's why blue state legislatures matter. We can't overlook them. If we're going to go into other states and tell them what needs to happen in these purple states, we need to make sure our house is clean too, and make sure that those red states have an example to point to that say, hey, this is what we can do. With that all being said, I just wanted to thank you all for, you know, giving me some time on the floor here to discuss. I have tons of things else to say too. Would happy to get into Moore versus Harper and what that may mean for state legislatures going forward too. But I do want to be respectful of my time, respectful of the time here, and would love just to turn it back over to Andre.
Thank you so much for that introduction. And I think, you know, basically we have a similar little intro for our group that we'd like to do, and then maybe we can move into discussion. So I have a couple questions that I'd love to ask as well, but I think maybe the most time efficient thing would be just to move to the next set of updates, and then open things up a bit more. I'm seeing one question in the chat. Who is the gentleman who just finished speaking? It's Amory, is that correct?
Amory.
Amory.
I'm the executive director here.
Executive Director of Downballot Progress. Thank you so much for joining us tonight. So folks, I'll go ahead and do a quick rundown of Medicare for All Everywhere, so you can see that section of the agenda. I guess I'll share my screen because I have a video as well. So let's just go ahead, and you can find this video right on the homepage of MedicareForAllEverywhere.org. and it is titled, "We Need Medicare for All Everywhere." Oops, it's not letting me do full screen within the web page, so we will open it up in a new tab. The United States of America. We pay nearly twice as much for our healthcare system as any other industrialized country, and yet we live shorter, less healthy lives. We're one of the wealthiest nations to ever exist, yet our healthcare system leaves over 26 million uninsured and many times more underinsured, resulting in around 500,000 bankruptcies related to medical bills every year. We need Medicare for all, and we need it everywhere. Medicare is a public health insurance plan from the federal government. It covers elderly Americans after they turn 65. It's what's called single-payer healthcare, a kind of healthcare system where most doctors and hospitals operate as private practices, but instead of billing you, the patient, they bill the government, making the government the single payer of healthcare expenses. It currently covers over 62 million people, it's more cost-effective than most private health insurance plans, and it's one of the most popular forms of healthcare coverage in the United States. National Improved Medicare for All is the proposal that we create a universal, single-payer healthcare system in the United States by expanding Medicare to cover things like hearing, dental, prescription drugs, and more, while lowering the age requirement from 65 down to, well, 0. Healthcare isn't just for the elderly, or the wealthy, or the employed. It should be guaranteed for all. We've been fighting for it for decades, but how do we win? In Canada, the province of Saskatchewan became the spark of a healthcare revolution when it became the first to pass a single-payer healthcare system called Medicare. That system was eventually expanded to cover everyone in Canada. In the United States, we have a similar story for our own healthcare system. The Affordable Care Act was based on a statewide plan that had previously been implemented in Massachusetts, demonstrating the incredible influence states have over federal policy. In the US, we have movements for single-payer healthcare in many states, from the ballot initiative campaigns in Washington, Oregon, Colorado, and Maine, to legislative campaigns like CalCare and the New York Health Act. Single-payer advocates are fighting all over the country to make healthcare free and universal, but for the most part, they have operated in individual silos rather than as a mass movement. That's what got us thinking, what about joining these movements into a national coalition? What if we raised money together so that we could develop movements in every state? What if our organizers worked across state lines? What if we marched together in solidarity every year? If we combine our efforts, one state just might break through and pass a statewide version of Medicare for all. And from there, it will spread and spread until we have Medicare for all everywhere. We are an aspiring coalition working to unite single-payer campaigns in every U.S. state, territory, and district behind a bottom-up mass movement for Medicare for all everywhere. We demand healthcare justice at every level of government. Follow us on Twitter at M4A_everywhere, or go to medicareforalleverywhere.org to learn more, sign up to volunteer, or make a tax-deductible donation. So thank you for watching that, everyone. It's the most concise summary of what we're about. We're a healthcare first organization, is what I would say. We put Medicare for all right there in the title to keep that vision. And we're serious about building a coalition that truly spans the entire country, and we mean every state, district, and territory when we say that. Right now we're only about a year old, and this is an aspiring coalition. We're still working out a lot of the infrastructure necessary to create that coalition, but we're very proud of the infrastructure we've built already. Other than the domain name medicareforalleverywhere.org, all of this costs us $0.00. You can see we're on, most of the major social networks and stuff. So this video will be on YouTube later, but you can follow us on Facebook, Twitter. This website itself is an open source software project, and you can file bug reports or send in features on GitHub. We're on LinkedIn. You can call us on the phone. And so, getting involved is a matter of pulling up our events calendar. We have weekly meetings on Fridays right now. But tonight's webinar is on the calendar. And as I already mentioned, our Slack, which kind of puts you through our code of conduct. But I think the most interesting thing that I kind of want to talk about is our structure, which is, we're a 501c3 nonprofit, but we do that through a fiscal host. So our fiscal host is Open Collective Foundation. And you can learn more about that on our website on the About page. This 2-minute video is honestly great for explaining how it works. But basically, this is the link to our Open Collective. And what this is it's budgeting software, but you can see that it says we're hosted by Open Collective Foundation. What that means is they're taking 5 to 8% of our donations. But in exchange, they're handling all of our bookkeeping. They're maintaining our 501c3 nonprofit status. They're keeping us compliant. And so that means that we have very low overhead, and yet we have a fully fledged legal 501c3 nonprofit. Down here in the budget section, you can see all of our expenses and all of our donations. So it's really, really based on transparency. A lot of open source software projects actually are funded and managed through Open Collective. So you can kind of see that tech sensibility in the way that this works. So if you are excited about this idea, if you want to build the coalition with us, you can see all of the different ways to donate. We've got monthly tier, yearly, one time, and then of course a custom donation where you can set it up any way you like. So if you go to our website and hit donate, you'll see it's just a completely normal donation page, like with any other organization, but it goes through our Open Collective and basically keeps us completely compliant. And then you can see how much money we have on hand down here, right? So a couple $100 on hand. There's our annual budget. But let's say you did an action with Medicare for All Everywhere and you need to be reimbursed. You can simply go to this page, hit actions, submit expense, and then before you know it, you're submitting an invoice with a receipt, and we can go ahead and get you reimbursed. So this is really designed to create an open, collaborative sort of space where it's really easy to participate, and that's how we think that we're going to be able to create such a ambitious organization with a nationwide scale without giving ourselves way more work than we're going to be able to handle. So that's a little bit about how our organization has been set up so far. We only just got our fiscal hosting, and so we're looking at 2023 as a year of huge possibility, where there's all sorts of things available to us that weren't when we were just unofficial volunteers. With that, I think we can kind of move into a discussion based session of the meeting. And I had a few questions that I set out ahead of time, and we have a platform called Slido where you'll be able to send your answers in and we can look at them together. But before we jump into those, because they're kind of more pre-planned discussion questions, I'd love to just jump into something a little more free-form and ask if folks have questions or ideas that they wanted to contribute. And I see we have one hand up already, so I'll hand the floor to Randy in just a second. If anyone else wants to talk, please feel free to just use that hand raise emoji or type stack into the chat, and we'll try to keep track of the order and get to you in a sort of fair and orderly way. So Randy, go ahead. What's your question?
My birthday's coming up on Saturday. Okay. Facebook always has these fundraisers on here. If I donated my birthday to your organization, are you guys listed? Are you guys listed on the so when I would say, okay, pick this charity to donate to for your turn your birthday to? Are you guys there anywhere? Yes, no?
So I don't know the answer to that question. Probably not, because we didn't do anything to set that up. But if Facebook is maybe doing some, highly intelligent, techie, creepy thing where they've scraped all 501c3s and added them to their database, then maybe. But it's definitely a good idea, and I think that we should definitely love to get set up in Facebook so that we could do, that kind of fundraiser. And we only just made our Facebook page, so if y'all want to follow us, we only have like 10 or 12 followers, but we'll be doing more stuff on Facebook as that platform grows for us. So thank you for the suggestion.
What's your Facebook page called?
Should just be called Medicare for All Everywhere, something like that. But I'll go ahead and put a link in the chat, and then you can all give us a like and a follow. Betty, I see you're up.
Yeah, my question is for Amory. In regards to the work and and this basically, I don't want to say services, but what you're actually trying to do, it seems like you've done a lot of research. And I think that research is important to a lot of different organizations across the country when they're, anything that they're working on. So is that something that you can offer as an organization? I mean, how does that work? Or do you or do you not?
We don't right now, and that's because there's 7,500 plus of these state representatives, and it is a lot to get through. So we're trying to, as best as we possibly can, at the time that's right. But it's something that we realized in the first cycle took too long to share, if that makes sense. A lot of this, and so we have to go back we've gone back and reevaluated that we'll have to release that sooner. Maybe we just start with just only Democrats and Democrats only, because what's the point of going to Republicans anyway? But a lot of this research is the stances are difficult to put into spreadsheets, so to speak, because they are intentionally vague. But what is easier to put into spreadsheets, and what we've had a better time doing, is researching the campaign finance reports of individuals, so that you basically know whether or not they are owned by a certain company, or whether or not they're owned by a certain company, or they are just completely genuine with the stances that they hold, regardless of the stances.
Thank you. I see a question in the chat. Does this organization, and I'll assume that it's Medicare for All Everywhere, have a relationship with one-payer states, which shares information between state movements? I will say that I was familiar with one-payer states for a number of years, and really like and respect a lot of their work. And some of my colleagues at Whole Washington and people on the call tonight are in one-payer states leadership. So we've always been in contact with them, and I would say maintain a friendly relationship with them. We specifically, when we founded this organization, used to talk a lot more about what the difference between us and one-payer states is. And I think that what we kind of settled on was that one-payer states has done excellent research and excellent information sharing. We were a little more interested in building grassroots organizing infrastructure. So more emphasis on bringing in a lot of people, in-person actions like marches, rallies, demonstrations, more focus on things like ballot initiatives and sort of direct democracy. So we believe that, there's a lot of ways we can collaborate with one-payer states. Out of all of the, single-payer healthcare orgs out there, they're definitely the closest to us in terms of their, philosophy and their mission. But I think that our sort of approach is different. as well as other aspects of how we're organizing. So we are never looking to replace or reinvent organizations, but instead to complement. And we think that one pair states has a number of strengths that that we would rather rely on than duplicate. And then where we have strengths, like in terms of social media and ground organizing, that's really where we want to add value to this equation. Lana asking, will each state have a representative? And yeah, so this is, we are currently in the process of forming a steering committee. So the organization was founded by myself, Terrence, and Betty, all of whom are here tonight. And for the moment, the three of us are handling most of the, when there's decision making and policy development and stuff, we tend to handle that, but we're trying to get away from that and move into a larger and more sort of open and democratic steering committee. So the goal is to start with a 5-person steering committee. The three of us are going to approve people from an open nomination / application process. So you should hear more about this soon, but you'll all be able to apply. You'll all be able to nominate people. Including yourself, by the way, the three of us are going to approve the steering committee members. And for the first 5 members, at least, we're trying to select people from different states so that we can begin to build out that coalition where it's represented by, a bunch of different states. So even though, we're not quite ready to bring on organizational partners, we think by having a steering committee with representatives from different states is going to help us build that partnership later. So that's the approach that we're taking with building the steering committee. And I wish I had the application open for you all today, but we're hoping to have it finalized by Friday. So if you're on our mailing list or in our Slack, you should see that application and have the opportunity to get involved. But somebody asked, are we looking for volunteers? And the answer is yes, we're looking for volunteers from every state, district, territory. We're looking to get them organized into teams. Right now we have a weekly meeting on Fridays. It's kind of like an everybody meeting. But as we grow, we'll be dividing more into teams and time zones and kind of trying to give people more local focus with check-ins nationally, I guess is. So we're still figuring a lot of this stuff out. But the answer is yes, we need as many volunteers as we can get from as many places as we can get. And we'll have a steering committee application open soon. Let's see. I wanted to ask one, which I had a couple, but I suppose one that I want to ask Amory is, you've mentioned, primary emphasis on progressive state legislatures, which puts you in very like candidate and electoralism territory, but you've listed a number of issues as the ones that you value. And I think ultimately it's the issues that we're trying to win. And so I guess my question is, how do you see the distinction between issue organizing and candidate organizing? Where do you see down ballot progress in that? How focused are you on issues versus candidates, or how do you fit those two pieces together?
50-50. We as a 501c4 decided it was best to, when we're forming this organization, we being the advisory board, formed this organization as a 501c4 because it was the only way that we could operate seamlessly between multiple states and trying to help candidates directly, working with them to get them elected. And a 501c4 though requires you to have 50% of at least 50% of your resources dedicated towards legislation and working on specific issues. So that's why we're set up like that. It's been rewarding though, because you get to compare and contrast the various tactics used within the state house versus a campaign.
Awesome. So I think we're rounding out the end of the meeting, and I had a few reflection questions I wanted us all to do together, and I did lose some of my tabs that I had open, dealing with all of the technical challenges. So if you'll give me just a second, I'll get this opened for you all. So let's see, open text, open text, open text. Okay, so in the agenda, there is a link to what's called Slido, and I'll put it in the chat now. Slido. Okay, so we have 3 reflection questions that we'll do together. And if you click that link, you ought to be able to submit an answer. And so the first one is, what are our major 2023 goals? And obviously, I know that this is an event that's open to everyone, and you can answer for Down Ballot Progress, you can answer for Medicare for All everywhere, you can answer for yourself personally. It's mostly intended to be thought-provoking, but thinking in the context of tonight's meetings, what do you see as some good goals for 2023? And feel free to submit them, and I'll read out some of the answers that I'm seeing. So we'll just spend a minute on that, and then we can open up the next one. Yeah, I'm seeing some answers come in. Very single payer heavy. I think we did a good job promoting to our people today, but I'm seeing establish a local hub for single payer and hold a march for the nearest major city on the anniversary of Medicare's passage. So yeah, we're hoping to get out there in the streets this year, and do some marches and rallies and occupations. Let's see. I see get a vote on single payer in New York State Senate. I love it. Triple the members of Medicare for All everywhere. Get ballot initiative language together for California single payer initiative. Yeah, this is a Washington one, but our single payer bill in the Senate Bill 5335, we are really, really hoping we can get a companion bill introduced in the House this year. Pass legislation on waivers to make it easier for states to get the federal money. Yeah, that'd be Ro Khanna's bill, would really help out with some of the stuff we're doing. Okay, great. Folks, if you want to get this answer in, get it in the next second or two, because I'm going to open the next one. In 5, 4, 3, 2. Oh, I see one participant typing. I'm going to leave it open and let you submit it. Develop concrete bottom-up power that can move the powerful obstacles in our way, developing alliances with union allies, growing grassroots coalitions. Love it. Okay, next question is now live. Question is, what are the biggest strengths and limitations that we have as organizations? And I know that we have plenty of limitations as such a new organization. Okay, I'm seeing answers come in. So I'm hearing, broadly speaking, limitations of left-leaning orgs is keeping the eyes on the prize and not getting sidetracked with other issues. Oh my God. We're saying it out loud. Huge problem. Let's see. So this one was mine. Navigating lobbying regulations as a 501c3, establishing effective governance and defining the right coalition criteria. We still need to figure a lot of that stuff out. Let's see. Strength includes enthusiasm and makes sense info. Big money puts a lot of information that we have to overcome. Yeah, so building comms that can actually rival the comms of well-funded opposition organizations. Biggest strengths: people power, passion, shared skills. Limitations: money. Too many fragmented organizations working on the same thing. That is true. At the same time, you know, sometimes the problem isn't that there's a bunch of organizations working on the same issue. It's that none of them are, you know, pursuing a good strategy. So there's a, you know, there's good to experimentation and there's bad to being split. So when we have good ideas, I think we should try to coalesce around them. Let's see. Strengths: compelling message and policy, majority support, widespread uninsurance and underinsurance. Limitations: still developing concrete, tangible forms of power. Strengths: strength of our mission. Weakness: most of our volunteers come in with not much knowledge. Yeah, there's a lot of training and stuff. Strengths: energy, policy knowledge, and willingness to try new things. Weaknesses: need to establish more partners and veterans of the single payer and community organizing space. Yeah, so I think there's a theme there, which is bridging kind of the old to the new, you know, and taking these old organizations that have accomplished a lot, but modernizing their approach. You know, I think a lot of what I think of Medicare for All Everywhere as attempting to do is modernize the way that the single payer movement has organized. Anyway, thank you all for your answers. I'll be closing this one in just a sec and opening the last one. So if everyone's good, 3, 2, 1. What are some ways our orgs might collaborate in the future? Oh, I say I don't even necessarily need to read these because it looks like you all get the responses. But I'll read them anyway, because maybe some folks aren't able to join us on video right now. So share best practices on how to develop union allies and get them to unofficially strike on Medicare for All. Sharing tools, collective fundraising, collective promotion. This one's mine. Developing a framework for understanding and evaluating state-level candidates on healthcare and developing candidate training. Volunteer events, phone and text banking, going to other states to help with signature gathering and other campaigns, lobby together. I see, would like to gather all of the state initiatives to coalesce. Yeah, so kind of coordinating them to run in the same year and kind of coordinate their message. Joint social events, joint social media events, sharing of our individual contacts in the organizations. These are all great answers, everyone. Let's see. I see one person still typing, so feel free to send another answer in. Strikes over public policy are officially illegal, but can be done through indirect call-in strikes. Good to know. We are obviously trying to organize effectively, and we're very open-minded and strategic, but we're also always learning. So we will probably learn a lot in this next year as we try to organize some of the demonstrations this July. But let's go ahead and close up the Slido. And thank you all for participating in that. And we're at 6:06. We scheduled this to go until 6:15. A lot of that's just a little bit of flex time because sometimes you got technical difficulties and stuff. So we don't need to stay on for too much longer. But now that we've gone through all of that and all of that reflection, I guess I just thought maybe we could open it up again for any final thoughts, ideas, questions. I feel really excited about everything we went over tonight, and I feel very good about the year, the 2023 that we're going to have, and I look forward to seeing what we can accomplish together and on our own. Let's see, Catherine saying, I'd like to know more about how striking over public policy is illegal. Yeah, I don't know. Does Slido save answers for admins? Terrence, I believe it will. If not, we can always copy paste them over. I think we at least have them for the time being.
I copied and pasted the first batch into the chat.
Oh, thank you. Lana asking, have we posted on Twitter as well? Is there a YouTube channel? Yes, our most active social network is Twitter, and we promoted this heavily on Twitter. We have a YouTube channel. It has exactly one video on it, and you all have, no, it has two videos on it, actually. The other one is that one of Pramila Jayapal. We do have a YouTube channel, and the video of tonight's meeting will be posted to it. Randy.
Can we get a list of all the actions that have been done already? Like who's got bills out, who's having, who's going to do a proposition, who might have a ballot initiative? I think it would be great to see what people are talking about, all these issues that they're doing. But it'd be nice to have them in a warehouse, or storehouse, or somewhere that says, "Hey, this is what's going on in the state of California."
Yes, and I think that we will be developing that over time. I'll just show you what currently might actually be the best version of what you're talking about, which brings us back to One Payer States. So if you go to onepayerstates.org, and actually there's one on healthcare now as well, but you see this states section. So you can start here and see if they have some information about your state. So I don't know, New Mexico, right? I don't know if anyone from New Mexico made it tonight. But you can see here, there's the Health Security Act, and usually there's some links to organizations and some good information. And then the other one, of course, is Healthcare Now. They have chapters, many of which are listed. So, you know, we're trying to collect this together and not just put it on a website, but to build you know, a meaningful relationship with these organizations. And so, you know, these are good information warehouses, but I think what we're trying to bring to this is a real coalition where there's
Now,
sort of a
Facebook page. Now that you have a Facebook page, by the way, I joined. The question I have is, can you possibly put links, or put, when you guys do posts, you can say, hey, this is what's going on here, please join. Because once you start seeing everybody, there's a lot of Facebook users who probably don't know about who you guys are. So sharing is very important. So sharing those links on Facebook would be very important. And then the people click and they'll share again. There's a lot of talk shows. I was thinking about Tom Hartman, and I was thinking about others that are very strong on this issue. And there's a lot of Mike Malloy and radio people who are very friendly to where our issue is. And so, you know, getting it out there would be one way you guys could possibly talk about your organization and say we're a collection. And that's one of the big things you guys can do, because we got, not only have social media, but we also have podcasts and radio and TV.
awesome. I'll just share a little bit about that. This is, again, you know, Medicare for All Everywhere context. But if you go to our website and you go to the About section and you go to this media section, You can see some of the media appearances we've already made, and you can listen to them. And then this is also where it will explain how to get in touch with us if you'd like to schedule a media appearance. We definitely can be doing a lot more of this. We don't have that much media access yet, but we certainly want to be doing like newsworthy things all the time and then getting covered for it. And I might have had another point or two. Oh, the Facebook. Yeah. When it comes to Facebook, you know, we just made it. There's barely anyone following it. And all of our stuff, right? You can see here, we have LinkedIn, Reddit, like everything, right? All of these, the more we get people who are willing to volunteer to help us run and moderate these things, the more activity you'll see. So right now, I run the Twitter, and if I have a little bit of extra time, I might run the Facebook or something like that, right? But if we had 5 people on Twitter and 5 people on Facebook, they'd be popping content out all the time, right? So,
I'd like
you
to
know,
help you with Twitter. I do Twitter all the time.
that's fantastic. So, Randy, we can go ahead and follow up after this, and we can, you know, maybe figure out how to make that work. But yeah, in general, you know, a lot of what
you can link into our organization, which is Healthcare for All, and Maureen Cruz's organization, which is Healthcare USA. And so these are we all try to work together. And so I figured, you know, Twitter, I'm on Twitter all the time. So
awesome. Thank you. And we'll be in touch about that. And same goes for the rest of those social networks. Folks, always feel free to volunteer, to make suggestions, because we're really are just trying to plug people in. You know, we're very based on volunteer effort, and we're trying to be the sort of organization where when we hear people bringing their own ideas and enthusiasm and suggestions, we basically just want to say yes, and then direct it towards our longer term goals. But anyway, we're at 6:13. So unless there's anything, you know, extremely important for folks to squeeze in the last minute or two, I'd love to wrap the meeting up. Any final thoughts to hop on? All right, let's go ahead and close it down then. We can say a quick few goodbyes. So I will say it one more time, and I know I've said it a million times already, but we so appreciate Downballot Progress for the work you're doing and for joining us tonight. Amory, it's been really nice to meet you. And I hope you feel well acquainted to us and our work, and that you'll hit us up anytime that idea sparks and you're like, what would Medicare for All Everywhere think about that? Would they want to join? The answer is yes. So thank you so much. And I hope you have a great rest of your evening.
Thank you for organizing this. I really appreciate it. And thanks everyone for being here.
Terrence, did you want to get a word in? I see you unmuted.
Oh, just thank you. Yeah, thank you so much, Amory. Thank you to Downballot Progress for joining us. Thanks for everybody that stuck through the change of online venue. And everybody, hope you all have a good night.
Oh, I'll add one more thing. I'm so terrible about this. There's always one more thing with me. I'll just say, you know, we are really based around the idea of being a coalition, and we're almost trying to be as small of an organization as possible, while, you know, sort of delegating out to that coalition and more building connective tissue between existing organizations and the work they're doing, rather than trying to do all of that lift ourselves. And so we're trying to figure out how to build that coalition and how to develop those relationships. And I think one of the things we've learned is that maybe the best way to start is just to reach out to the orgs and say, we're really interested in your work, and would you like to do a webinar with us, just like we did tonight? So that is to say that this was a little bit of an experiment with us. Downballot Progress is kind of the first org that we've done that approach with, but we're really happy, I think, with the result. And so for all of you out there who are part of other orgs or know people associated with other orgs, if you want to set up a webinar just like this, we can go join one of your meetings, or you can join one of ours, or we can set up a special one. Just send an email to info@medicareforalleverywhere.org, and we can get it scheduled. And yeah, it can be just a really low pressure, like, you tell us about you, we'll tell you about us. And then, we'll see where things go from there. But we think that's the best way to start a relationship that, in time might lead to a coalition partner, or maybe just a co-organizer on the occasional action. But the more we know each other and stay in touch, the stronger all of our efforts are going to be. So please feel 100% free to just start the email. You can email us directly, or better yet is email the organization that you want to set up the meeting with, copy us and say, well, I just wanted to introduce you to, and then we can take it from there, So that's kind of the system that's worked well for us so far. But thank you again, everyone, for joining us tonight. I hope to see you soon. Our next weekly meeting is Friday. It's on our event calendar, so you can join us Friday at 2 Pacific, 5 Eastern. Or there'll be another webinar or something soon. We're on Slack, we're online. So we hope we're making ourselves easy enough for y'all to find. And we will be out there organizing, and we hope you'll be there with us. So thank you again, and have a great rest of your evening, everyone. Bye.